Good morning, everyone. So today's my talk is on cure rate of lung cancer. As we know, low-dose CTA screening for lung cancer, low-dose CT can detect early stage lung cancer. We can find nodules when they are tumors when they are still very small and in the earlier stage. So therefore, more treatable. So for a lot of people who are considering to be screened, the key question to them is they will be asking is, if I'm diagnosed of lung cancer, what are my chances of being cured? So according to this, cure refer to the complete clinical remission of a cancer, regardless of the presence and absence of a late sequelae of treatments. To correctly apply the word cured, the time from cancer diagnosis must be such that the patient's risk of death does not, because of cancer, exceed that of a sex or age and age-matched general population. So cure rate can be estimated from the plateau of a cancer-specific Kaplan-Meier survival. In lung cancer screening, the benefits, we expect to see the benefits a little after a while. And the consensus is that it will plateau around 8 to 10 years. And in the graph below, we can see that this is just a figure showing where the plateau is. Once it plateau, we say that that the time here will be here. This is when we expect lung cancer, the patients is being cured. So in 2006, we published this paper in New England Journal. We reported on over 31,000 I-ELCAP participants that underwent screening, and we found 484 lung cancers here. And we reported the 10-year lung cancer specific survival was 80%. And among the clinical stage 1, those that also received early treatment within 1 month, the lung cancer survival was up to 92%. So at that time, we can already see the plateau over there, but some of the criticism was that the number of patients here towards the end was very low. So there were questions that whether that was really a true cure rate. So although later on in a few years later, the NLST result came out, and with the extended follow-up, they reported that you can see that around 8 to 10 years, we also see for stage 1 lung cancer is starting to plateau around 73 years. They're a little lower because of the differences in population and the protocol. So in the earlier presentation, Ilya also mentioned this paper. In 2023, we published in radiology. This is also a paper that won the best paper, scientific paper award in RSNA. It then looked at 20 years follow-up in I-ELCAP participants. At that time of the reporting, we have close to 90,000 I-ELCAP participants, and we see that the 10-year survival of these lung cancer patients with lung cancer is 91%. And if we look at 20-year survival, the survival rate really persists, is remaining at 81%. So we're now be able to say that these patients are really cured. They have been cured. And when we look at the pathology stage 1, cancers that's less than 10 millimeter, the survival rate was 95%. So it's also suggests that when a patient undergoes screening and you can detect small lung nodules when they are small, and they can really be cured and with a very high survival rate. So with that in mind, we can also all see that from the staging system, current staging system, that as the sizes of the nodule or the sizes of the tumor increases, the relationship is that the survival rate will decrease. So size will impact survival rate. And we expect that cancers can behave differently. So besides size, there are other factors that can change with the cure rate, and such as whether it's subsolid, whether it's part-solid nodule, the cancer was found in a part-solid nodule, or a non-solid nodule. And here you can see that at least in our I-ELCAP database, for among subsolid nodule, the survival rate was essentially 100% here. And also by cell type, we know that adenocarcinoma tends to have a higher cure rate. And here in our early paper, we reported on the percentage of BAC, which is now lipidic component. As the increasing lipidic component, the survival is better. And we can also see that, we can also say that whether the cancer was found on baseline cancer, whether it's a baseline cancer or any cancer, the survival rate we expect also to be different. So what does this mean to the patients? So the patient next, once they're diagnosed with lung cancer, they will ask, at what point can I consider myself cured? So with this important information, we can now be able to tell the patient that if you're, let's say the patient is now have lung cancer at 2 years, we can say that if you remain at cancer-free for 2 years, the chance of cure rate is increasing. So as each year goes on and you stay cancer-free, your chance of being cured goes up. So here, if the patient is reaching in 10 years, we can tell them that they can consider themselves to be cured. So as I mentioned earlier, we expect these cure rate to be different by subgroup. So for non-solid nodules or subsolid nodules or nodules, cancers of smaller size, we see that the plateau or the cure rate will be earlier. So in summary, low-dose CT screening improves outcome by shifting diagnosis to small early-stage lung cancer, which lower lung cancer mortality, long-term survival, stabilize, and we see the plateau around 10 years, and our estimate has proven to be the cure of lung cancer. And the cure rate differs by subgroup. Smaller nodules, subsolid nodules tend to have a higher survival. And it is also very important to, once we see the cancers early when they're small, diagnose them when they're small, they're followed by timely treatment. And if the very good survival rate doesn't convince people to get lung cancer screening, and the following talks and throughout the rest of the conference, you will hear more about the additional value of low-dose CT screening, as we can see other important findings on the same low-dose CT scans.